Hi everyone, this is the first video in the Health Literacy webinar series. My name is Heather and I'm from the Health Promotion team. With me is Lawrence, who is the Community Engagement Advisor. We have created some short videos highlighting the best bits from our recent Health Literacy webinar training. In this session, we are going to talk about what is health literacy and why is it important. Lawrence will talk about consumers and consumer participation, and I will talk about the benefits of improving health literacy for the organisation, staff, and our consumers. So what is health literacy? Health literacy is an individual's ability to obtain, understand, and use the health information and services they need to make appropriate health decisions. There are a range of definitions for health literacy, and some professionals consider it a working definition. This definition comes from the Victorian Primary Care Partnership's online health literacy course. This training course will be made available to all staff on Totara. It's good to think about health literacy as two components. The first component is the individual's health literacy, which is a person's skills, knowledge, experience, motivation, and ability to understand and act on information about health and healthcare. Examples include how much the person already knows about health issues, particularly their own health issue, the way their beliefs might shape their care decisions, and how much they know about weighing up risks and benefits. The second component is the health literacy of an organisation, which is how easy or hard our information or services are to access, navigate, understand, and use. For example, if you think about when a client looks at our website, how easy is it for them to find out what they're looking for? Is it clear what they need to do to access a service? And are eligibility, cost, and rebate information provided in an easy to understand format? The component we need to concentrate on is what our organisation and we as healthcare providers can do to make the information we provide easy to understand through the way we communicate and present information. It also helps to consider the barriers that clients may have in accessing our services or understanding and following the information we provide. For example, when a client is prescribed medication, they would need the knowledge and skills to read, understand, and be able to follow instructions on how to take the medication. They would also need to understand how different medications can be used to treat pain. And if they have more than one condition, they might need to know how to manage multiple medications. These are just a few examples. There are lots of simple ways that a clinician can help clients in this situation using techniques like teach back, motivational interviewing, and simple language. We know that many of you may know how to use these techniques, but how often do you actually use them in your everyday practice? Do you use them all the time and with every client? Do you use them sometimes, depending on the client, or not very often, only when it looks like the client doesn't understand what you're saying? A really important part of health literacy is acknowledging that not all of our clients have the knowledge or skills to be able to follow these kinds of instructions, or to remember all the information after they've left the appointment, particularly if they are managing more than one condition that requires them to take more than one medication. I'm now going to hand over to Lawrence, who is going to talk a little bit more about understanding our consumers and the importance of involving them in the design of our information and services.
Thank you, Heather. First up, I want to talk about who are our consumers in healthcare. And different health settings and different services use different terms, such as consumer, patient, client, carer, service user, and so on. Pretty much these terms usually mean a similar thing, and it is important to recognise that all of these people have something in common. They all have a role in having a say, and to participate in making decisions about their healthcare. For an official definition of a consumer in healthcare, Safer Care Victoria has quite a good one. They state that consumers are people, families, carers and communities who are current and potential users of health services. They go on to state it also includes people who choose to get involved in decision making, health consumer representatives who provide advice on behalf of consumers with the overall aim of improving healthcare, and carers who often have a very important role in healthcare decision making. Some good questions to ask yourself and your team. How are your consumers involved in developing their care and treatment plans? Do you see others involved as much as your consumer as your primary consumer? How much do you listen to other service providers and health professionals in designing your service and delivery to suit their needs in helping and developing better outcomes for everyone? Heather, if I could have the next slide. Why a focus on consumer participation? Well, there are a lot of reasons why health services focus on consumer participation and engagement. Every consumer at Access receives our rights and responsibilities document. In the rights and responsibilities document, it states that each consumer can expect involvement about decisions in their healthcare plan, and that we, the staff, will listen and respond. Access enables consumers to be involved in a number of ways. This happens at the board level right through the organisation. There is a Get Involved tab on our website, which links to information about the Board Community Advisory Committee, local community participation, volunteering and employment. Old ways of doing things, are they the best? Traditional healthcare approaches may not work, or sometimes what works for one person will not work for the next person. If your approach is the same for everyone, it is likely you will miss the mark for some people and not produce the results you would expect. Some people want to be really involved in their healthcare, and others might leave every decision to you or someone else. Knowing what that means in practice is an ongoing challenge for healthcare providers. Our consumers also come from diverse backgrounds, beliefs and experiences. Our consumers will give us new perspectives, which help us review what we do and how we do it. Only when we hear their stories can we begin to understand what might be important to them. We will learn from those stories to find out from our consumers and work with them to discover what they need and want. Also, funding models over recent years have changed. Consumers now have control over what services they pay for. This has changed the dynamic and means that a greater emphasis has to be put into health literacy, service access and value for the consumer. The final point here is that government legislations and guidelines are all about consumer participation. For example, the Australian Charter of Healthcare Rights, the Disability Act, and many, many others. Examples of some of the guidelines that you may remember are Doing It With Us, Not For Us. That was around a few years ago. Diversity Planning and Practice, which is more recent. Community Advisory Committee guidelines, and so on. Universally, all of these point to consumer participation in healthcare planning, service, delivery, and review. Thanks, Heather. How is Access Health and Community supporting consumer participation? On this slide is a list of some of the ways Access supports consumer participation, and I'll briefly speak just about a few of them. Consumer participation happens at all levels within Access, and mostly at the level of clinical engagement. It is, however, everyone's responsibility to be aware of your role, including staff, volunteers, and consumers. As I mentioned, our website has a section called Get Involved. If consumers are not using the website but are interested in becoming involved, please let them know how they can be involved and give us some feedback. And there's those methods there through complaints and compliments, our various committees, and through our website and our community. Thanks, Heather. In this next slide, there is a list of consumer participation and engagement activities that each of us perform on a day-to-day basis. Sometimes we do these things and are not even aware of how important they are for your consumers to participate in their healthcare. The examples are individual care plans, and they've been around for a long time. Shared decision making and social prescriptions are newer terms, but have specific meaning in some practice areas. Consumer control over a funding budget. This is much more recent change, and schemes such as the NDIS and My Aged Care place much more focus on the client making their own decision around what supports they need or want, and choice about who will carry out those services. Health literacy is vital and the main part of this webinar. Do consumers know where services are, what they offer, and how they can be in control of those services? Again, I want to emphasise that stories from consumers and staff help others understand the specific needs and choices of a client and what barriers and enablers there are. No one has the same experiences or concerns that we have. You will learn from your client stories what they really need and want, and maybe what the barriers are for them to get involved and to participate. We are doing a project on developing a better suite of tools and resources. This is ongoing work. These will work better if they are in different formats, accessible and easy to understand. Knowing also the community you work in is really important. There are a lot of statistics and community profiles that you can access, which will give you an insight into who is in your community and what disadvantages and challenges that they may face. And finally, the last point I want to make is about co-design, which is a process by which clinicians work equally with consumers to plan and develop services, and also to review services. If anyone would like to see examples of how co-design works, I'm happy to pass on more information. Thank you. Thanks, Heather.
Thanks, Lawrence. I'm now going to talk a bit about health literacy in Australia, the importance of health literacy and the benefits for our organisation staff and clients. Approximately 59% of Australians aged 15 to 74 years have low health literacy. This means more than half of the consumers who access health services like ours are unsure of the information provided to them and of the service available to help them make informed decisions about their health. These statistics come from the Adult Literacy and Life Skills Survey. According to the survey developers, those Australians that scored low levels of health literacy do not have the minimum skill level required to meet the complex demands of everyday life and work. Health literacy is important because it affects people's long-term health outcomes and the safety and quality of the care they receive. People with low health literacy are more at risk of hospitalisation and emergency visits, poor access and utilisation of health services like ours, increased risk of taking medication inappropriately, and a higher risk of death among older people. These are just a few examples of the many risks of low health literacy. The benefits of improving health literacy for our organisation, staff and clients is to improve the safety and quality of the healthcare we provide. The National Safety and Quality Health Service Standards include a number of actions related to health literacy and around supporting partnerships with consumers, as Lawrence has already mentioned. It will also contribute towards continuous quality improvement. Improving health literacy also aligns with our organisational values. By making our service more accessible to those disadvantaged population groups, we will reduce health disparities and increase equity. By enabling clients to be more involved in their healthcare and care plans, we will improve the quality of our care. It will also help to empower our clients to make more informed choices about their healthcare. In the next video, we will talk about our role in improving health literacy and how we can use the universal precautions approach to ensure our services and the information we provide is accessible to everyone. Thank you for tuning in, and we hope you tune in to our next video.